So to better understand these treatment efforts, I'm going to first explain cerebral perfusion pressure and intracranial pressure. And cerebral perfusion pressure, also known as CPP, is the pressure needed to maintain blood flow to the brain. And a low CPP is associated with ischemia and brain cell death. And CPP, it can actually be calculated by subtracting the intracranial pressure from the mean arterial pressure, which is a measurement of blood pressure. So as you can see here, as blood pressure decreases and or intracranial pressure increases, there is a reduction in blood flow to the brain. So what is intracranial pressure, or as we say, ICP? It is the total pressure exerted by the three components within the skull: it's brain tissue, blood, and cerebral spinal fluid. And so under normal conditions, it's between 0 and 15 millimeter mercury due to autoregulation within the body. And intracranial hypertension is ICP sustained above 15, and that's the result of uncontrolled increases in either the brain tissue, blood, and or CSF. And then malignant intracranial hypertension is ICP sustained above 20, and that's what we're most concerned about in the neuro-ICU, because that's associated with a decrease in CPP, ischemia, and it can lead to herniation and brain death. So often we rely on an external ventricular device to transduce ICP values and monitor for an increase in pressure. In Megan's case, she did not have an EVD, so we relied on clinical symptoms and her neurological exam to monitor for ICP changes. So signs and symptoms of increased ICP are due to compression of the cerebral cortex and cranial nerve. And so these signs and symptoms vary depending on the cause, location, and rate of pressure increase. And recognizing the signs and symptoms of increased intracranial pressure within the neurological exam is a key aspect of monitoring patients with closed head injuries. And so this is just a list of different signs and symptoms of increased ICP and then how they correlate to the neurological exam. Let's go over a few. Important to note, the most sensitive and reliable indicator of increased intracranial pressure is a decrease in level of consciousness, and then this can present as confusion, lethargy, or coma. And often we use the Glasgow Coma Scale to quickly assess level of consciousness. Pupillary abnormalities, we use a pen light to check for changes in pupil size, equality, and reactivity. Pupils that are unequal, fixed, or dilated and indicate compression of cranial nerve 3 and herniation of the brain. And then just changes in vital signs. So increasing pressure on the thalamus, hypothalamus, pons, or medulla can cause changes in vital signs. I know the trauma nurses were talking about storming. And therefore, it's important to continuously monitor the vital signs. And just monitoring vital signs is important in assessing for Cushing's triad. And this is where there's a marked systolic hypertension with widening pulse pressure, bradycardia, and altered respiration. And this is a late sign of impending herniation. So ways that we can prevent increased ICPs. One way is we can decrease cerebral tissue expansion. We can do that by reducing cerebral edema and removing space-occupying masses such as a large hematoma. We can also decrease blood volume. We can maintain adequate venous drainage. And nursing interventions include keeping head of bed at 30 degrees and maintaining proper neck alignment. And then also to decrease blood volume, we can treat hypertension using medications such as PRN, hydralazine, and labetalol. And we can prevent cerebral artery vasodilation by reducing metabolic waste and preventing hypercapnia. And then third, we can decrease cerebral spinal fluid volume. And this can be done with an EVD by draining off fluid or putting in a shunt surgically. And so one of the most important ways to manage ICP is through reduction of cerebral edema. And cerebral edema is the abnormal accumulation of water in the intracellular and or extracellular space. And it's associated with increase in brain tissue volume and increase in ICPs. And peak swelling is usually 2 to 4 days after the initial injury. And it can be diagnosed using scans such as CT or MRI. And so different treatments of cerebral edema. And Megan had all of these. One is a decompressive craniectomy, where a portion of the skull is removed to allow room for the brain to swell and decrease the ICPs. And it's usually done in conjunction with an evacuation procedure, such as taking out that subdural blood clot on the top of the brain. And so Megan did have that shortly after she was admitted to AGH. And then also using osmotic diuretics such as mannitol and hypertonic saline, commonly called 3%. And that works by drawing water out of the brain tissue into the intravascular system where it can be diuresed out of the body. And mannitol has neuroprotective properties. And both with mannitol and 3%, important nursing considerations include closely monitoring urine output for volume depletion and blood pressures for hypertension, also checking electrolyte and blood osmolality levels, and especially with 3% saline, making sure that there's not too much sodium in the blood. And so this is just a little, review of your osmotic principle. On the left-hand side, you have, area of high water concentration, which would be like the swelling brain tissue, and on the right, area of low water concentration with more solutes, which would be like your blood treated with the hypertonic saline, and so you can just see how water would flow out of the brain tissue and into the intravascular system. And then this is just a little review of some of the concepts we just talked about. Like contusions and other closed injuries can cause swelling and increase ICPs, which decreases the cerebral perfusion pressure, and how that leads to more hypoxia, and how kind of it's like a circular that even makes it worse. And then also at the bottom, the systemic insults, how that also adds to this process. So now John is going to talk again and focus on some of the systemic insults that can adversely affect closed